Well, restless leg syndrome is considered a hyperkinetic movement disorder. It's for a neurologist, it's a movement disorder problem. And usually the patient would come and explain the situation that they are having tingling, creeping, crawling movements in their legs, mainly in their calves and their feet. And it usually happens at night time when they are about to go to sleep or at any time when they are resting. There are 4 criteria by which we diagnose it. It's first of, and all of these are clinical criteria. Number 1, it is a creepy crawling feeling in the legs. Number 2, it has to happen at nighttime. Number 3, it has to, or at any time when they are resting. And then in the end, it has to be relieved by movement in the legs. There are 2 different type of restless leg syndrome. One is primary restless leg syndrome and then secondary restless leg. Primary restless leg syndrome is a hereditary condition, and it is usually in almost 70 to 80% of people. And then rest of it is around 20 to 30% of patients is secondary to some diseases. There are multiple diseases which have been postulated to cause it, including peripheral neuropathies, and sometimes people with CHF, pulmonary problems can have it too. It's a chronic disease. Once it happens, it's a lifelong disease if it is a primary restless leg syndrome. If it's secondary, we have to treat the secondary cause, and then you can make it better by treating the cause behind it. If it does not get treated, the patients will have a lot of pain. They will not be able to sleep at nighttime. That's where the sleep issues come, because usually it happens at nighttime. Their sleep latency, the time in bed up to the time you actually go to sleep, is increased because of this. And then your sleep efficiency, which is how much you sleep when you are in the bed, goes down. And then you have frequent awakenings. So if you are frequently awakened by this problem, you'll not be able to rest at nighttime, and the next morning you'll have excessive daytime sleepiness and more problems. So if it gets untreated, yeah, definitely the numbness, the tingling and creepy crawling feeling is there, but you'll not feel better in the next morning because you'll not be refreshed by your sleep. It's a hereditary cause behind it for the primary restless leg syndrome, and it's an autosomal dominant disease. So any patients who have it, there is almost 50% chance that their children can have it too. There are some cases of autosomal recessive explained as well. So you cannot prevent hereditary causes. Now for the secondary, as I mentioned, heart failure patients, peripheral neuropathies, and pulmonary problem can lead to this problem as well. You can prevent those by taking good care of your heart, lungs, and nerves. One of the most common reasons why a neurologist see a patient with restless leg syndrome is peripheral neuropathy, and there are hundreds of causes of peripheral neuropathy, and you have to prevent them from happening. Like diabetes, you can have a better control and prevent having peripheral neuropathy. You can have a thyroid problem leading to peripheral neuropathy. So you can prevent those, but probably not the hereditary causes. Because there have been studies done which have showed that almost 80% of patients who have this disease, they go to their primary care physicians and try to explain it to them, and almost 6 to 10% of those patients get diagnosed with RLS. So we are a lot behind in diagnosing this disease as causing so much trouble, number 1. Number 2, there is a thinking behind it that it is a disease of older population. There have been studies done that it has been explained in people at the age of infancy. So even if a younger person comes to somebody who has some of these feelings, probably there is a chance that they have RLS. So this is something, as a physician, we should do better in diagnosing the disease And again, it's a clinical diagnosis. You cannot do a test to diagnose it.